Your tight hip flexors are pulling your pelvis forward or into an anterior pelvic tilt. Now I need to clarify something. Your hip flexors are more than your psoas. So anything that flexes your hips and brings your hips up closer to your chest is involved in it. Some of these hip flexors are directly, their action is hip flexion. Some of them are accessory to hip flexion, meaning they're helpful or they do some degree of hip flexion and something else. So when it comes to pelvic floor dysfunction, we're so busy looking at the floor of the pelvis without asking the right why questions. The question, in my opinion, should be, why is my pelvis tight? Or why is my pelvic floor, I should say, tight or weak? It is a direct response to something else. Its presentation and its impact can just impact or be presented in the performance of those muscles or the performance of some of the internal organs that this bowl, this pelvis, is holding, like the prostate, uterus, ovaries, bladder, and lower intestine. So when I have an alteration on the external outside of my body in balancing my pelvis, if it's being pulled down or up, it doesn't matter. If that's happening, you can bet your life, bet anything, that comes with an adjustment and the tweaking and modification of the status of the muscles of the floor as well. So when we go in and we try to go through the vagina and or anus, in case you don't have a vagina, and try to solve a problem without going and asking the right question, which is, why is it this way? Then we're really not solving the problem fully. Just wanted to bring that to your attention because the way we're looking at the problem is not necessarily, in my opinion, the right way. Certain things have to happen first before we get there. So we don't want to miss step 1, 2, 3 and jump on 4 and think now the problem is solved. I just wanted to bring that to your attention. I'm Dr. Shakib from Core Pelvic Floor Therapy right here in Irvine, Orange County, and we see patients of all ages, genders, and hypermobility status. Thanks for watching.